Hello, everyone, and thank you all for joining us during the Lytham Partners 2024 Investor Select Conference. My name is Ben Shamsian, Vice President of Lytham Partners. Our next presentation comes from Syra Health, ticker symbol SYRA on the NASDAQ. Syra completed its IPO and began trading on the NASDAQ in October of 2023. Presenting from the company is Sandeep Allam, Executive Chairman and President of Syra Health. Today, I've asked the company to briefly run through the slide presentation, and then we will engage in a fireside Q&A chat. As a reminder, the company will be available for one-on-one virtual meetings. If you have not already signed up, please send me an email at shamsian@lythampartners.com. That's SHAMSIAN @lythampartners.com, or visit lythampartners.com/virtual and click the one-on-one meeting request button. With that said, let me now turn the presentation over to Sandeep Allam, Executive Chairman and President of Syra Health. Sandeep, please proceed.
Yeah, thanks, Ben, for the opportunity here to present to the investors and also participating in the Lytham Partners conference here. As a Syra Health, we are healthcare and a technology solutions company. And again, we focus on healthcare's biggest challenges and focusing on the unmet need in the market. And all of our solutions and products that we have are very based on kind of the what you call the unmet need in this market. And this is also based on a lot of deep market analysis we have done and seen the opportunity and where customers have a need in for this particular solutions that we have launched. And we focus on, we are centered around prevention and access and affordability. So these are the three things that all of our solutions and products are part of this, and also where our company is, again, all this, solutions and products are which is into, of course, digital health, population health, and I'll go in a second on all those business units, what we call it as. These are high margins, with all the solutions for whatever we have right now. So, and that's how we, in fact, that was part of when we did our initial analysis and opportunity, and that was one of the things important for us of ones where we have high margins from a revenue and as well as, of course, from our profits and all. So, yeah. The company is kind of the way we have structured is based on business units. And behavioral mental health is a business unit, digital health, population health, healthcare workforce, and health education. And we have also added recently, very focused on the federal side of the business, which is the government solutions. And to the right, what you see is this is our target audience, right? These are we call them as our partners, and also these are our customers we work with, which are payers, providers, life sciences companies, and government, and of course the academic institutions. And all our solutions and our products are centered around all these customers that we have. Starting out on the behavioral mental health. It is two things. Part of this, what we have launched. One is on the prevention side of the prevention side, and there's on the telehealth side. This is AI backed, and this is purely we have taken the evidence-based approach in this. But more importantly, on the prevention side, we absolutely focus on the baseline assessments to start with, and we give the initial scoring, but also we believe in monitoring and maintaining the members, and that's what this app does. And we are going to bring all these members on a subscription fee. And the most important thing is that the intervention is by technology, by education, by videos, and also some activities, and there's some much more great features in this. But also, we have one of the big feature, which is AI backed, which is the diary, where we are having the members put their thoughts, and also there's a lot of interactive conversational AI built into that, so that we are interacting with the members every single time every single day, and a lot of notifications come up for them to react, and a lot of interaction happens with the members. And this is definitely on the prevention side. And of course, we have the telehealth built-in part of the Serenity app, where they can get some appointments in less than 48 hours with a therapist or psychiatrist and psychologist. I want to move on to the digital health. If you see the opportunity size to the right, and based on the two products and the two services, what you see, which is Syra and K Plus are the products, which is focuses on a chatbot, but again, it is very specific solutions for different type of customers that this Syra is about. And also the K Plus is an EMR system. It is very focused to small and mid-sized markets, and also we have extensive customization we can do for these purposes. The two services, cybersecurity, are the recent launches we have, and also the modernization of applications. We convert, of course, we work on the legacy systems and try to modernize the systems. So right now we are very specific in the government space. And these are the typical projects that you see on the size that you see as you keep on going, right? On the services and the products, the typical size of the contracts, which you see on the right. The next one being is on the population health. Two service lines we have is on epidemiology and also the data hub. A lot of analytics, and we work on the public health data. And currently we have a number of number of wins and we are working in more than 5 states right now. And their epidemiology services is one part, and also this is a data hub is nothing but a platform which has not only we are capturing a lot of data from different sources and our own based on our own contracts as well, but also we are running a lot of analytics part of that, and also this is catered to differently for different type of audience, which is it could be very different for life sciences companies, how they want this data to the access to this data and how they want to look at it, and also a difference between a payer, how they want to see this data. So it is kind of catered in a different way for different audience. The next one being is the health education, very specific to trainings for payers, for providers, for life sciences companies, and we are, and the patient education is one of them as well, which we focus on the same kind of audience that we have with the customers. A lot of different trainings. From health equity as an example and more. And so we design, customize, and we deploy these trainings for our customers. And the last one is on healthcare workforce. This is our beginnings. We have won a major contract and with the state of Indiana serving a psychiatric hospital. And that's our journeys begin on this particular business unit. And right now we're in 15 states. Winning statewide, we have statewide contracts, and we are bringing workforce solutions and bringing healthcare professionals for this particular contracts, which are definitely into registered nurses and CNAs and BHR specialists and so on. Currently, on coming back to the contracts in specific where we are today, this is more on the assessment side of the business. One of the major contract we have and partnered with is ENI, which gives access to 6,000 universities and schools, because that's where our deployment is going to happen on the Serenity app. But also we have done some assessments that we have done from a services standpoint of view for the 2022. And we have a couple of contracts going on, but much more important on this one, you'll be seeing a lot of growth in this particular area, because we'll be deploying the Serenity for the prevention as well as for the telehealth to different big employers, schools and universities, and different groups, as well. Another contract for digital health, we are right now for this, which is the chatbot. We are almost actually deployed it. And you can see the contract size, which is more than $2 million. And there's a product part of the digital health that's where we won the contract on the chatbot side. Apart from that, the population health, as I just mentioned, we are more than 5 states right now, and you can look at the contract sizes, which is very specific to the public health data, which is more towards the epidemiology, and the data hub where we are. The healthcare workforce, as you see, we are in more than close to 15 states right now, and some are in the final stage of approvals. And these are our contract sizes as well as fixed versus non-fixed. And currently, we are working on deployment of this resources, which is nothing but healthcare professionals for this one. Apart from this, how we are from a revenue distribution between all the different business units and a comparison. Right now we are definitely into digital health, population health, and apart from the healthcare workforce. And you can also see from a revenues versus margins where we are between all these business units. Currently, definitely from a revenue standpoint of view, where we are from 2021 to 2022, there's definitely an increase of 300%. And we anticipate a similar kind of percentage of growth as we move forward as well, especially from 2023, especially for 2024. That's where we are kind of anticipating along the same lines and working towards that. The next one is just where we are today on total outstanding shares at 13 million, and the Class A is 5 million, 5+ million shares here, and we are currently, when we went for IPO, the price was at $4, and the IPO at the IPO round we were at 1.6 million shares. Yeah, that's how. And we have September 29th is when we got listed on NASDAQ. And as I just mentioned, that's where we are. Overall summary with the contracts, and especially with some of the solutions and products that we have across the business units, we definitely have some major contracts that we have secured, and which are the good part about this is that these contracts usually, especially in the government side, these contracts are anywhere from 2+ years. Sometimes, in most of the cases, these are 4-year contracts that we have, which you see those amounts which are spread out between those 4 years. We're also looking at some major, as I said, Serenity is the behavior mental health and we are looking at some major growth in this. And that's the app, that's a product that we have launched, product and service, which also has telehealth in it. Here's our leadership. That's me in the center. I'm the president, the chairman, and also we have our CEO, Dr. Deepika Vopalanchi, and who's also board of director, and also Priya Prasad, who's the chief operating officer and chief financial officer as well, who has also an extensive experience in this. We also have board of directors who have different type of experiences, and they carry different backgrounds. And of course, all of them are in the healthcare space, and so we are very fortunate to have this board and who's helping us a lot in the direction and also the growth of this company. Just as a history, we are headquartered in Carmel, Indiana. And of course, we are a woman-led company, and our ticker symbol is SYRA. And of course, as I just mentioned, we are publicly traded on NASDAQ from September 29th. And currently, we are close to 166 employees, and that's where we stand.
All right, thank you, Sandeep, for this overview. I want to expand a bit on some topics. Can you speak about how technology and specifically artificial intelligence is helping your business?
Yeah, so artificial intelligence, again, is pretty much, we are utilizing that in all of our solutions and products, especially on the product side. In every system that we are developing, artificial intelligence is playing a major role. And we have recently hired a leader for that, director for the AI. And all these AIs, of course, they are embedded in all of our products, as I just mentioned. And again, very specific to it, we just wanted to make sure one of the biggest reason we are making the AI as our what do you call a technology that needs to be utilized is to ensure it benefits the end user, and it is in a lot of these products. And also we are trying to look at the different use cases, different scenarios, how AI can be fit into these products. Again, we are committed to a safe and responsible of use of AI as well. So yeah.
Oh, great. You've announced many contracts wins in recent months, lots of press releases, and you've put a few of them on the presentation you had made. Can you speak about some of the more significant ones and why they're so important?
No, absolutely. A new contract win we just came out is for with the Indiana Department of Public Health, and which is very specific to on assessments and but also we are focusing a lot of on the population health, on the public health data. And these kind of contracts are playing a significant what do you call a good great exposure for the company because we are playing a significant role in these contracts, especially in the public health side. It puts us on the map for that purposes, and we actually also chair a lot of these committees, part of this with the state agencies. And apart from that, if you look at this contract, some of them are focused on states, especially states' readiness to respond to especially to the public health threats, what's going on. And then we are participating in that, and these contracts are definitely great wins for us to execute from that perspective. Um, we also have another couple of more contracts, and also these contracts are for a longer term, so that puts us on and also extendable, especially when you work with the government, and that is definitely becomes more the contract wise and looking at the future of these contracts and based on this extension, it becomes more valuable for us as well. That's going to probably I've given an example on the most recent one that in fact we just won like yesterday. So yeah.
Great, great. Thank you. What are you doing to win more contracts in 2024? I know you have an RFP team currently, or is that team expanding? Help us out with that.
We continue to invest in our proposal team, and we are bringing in a lot of experienced RFP writers, and also we are moving into we're very heavy into the federal contracts as well. That is a big change for 2024, and we are expanding and going to that. We are definitely based on the team what we have. We are into the most public and private sector, but when you talk about public sector, we are very focused on states, right? And that's where we have our proposal teams writing. Continuously, consistently there, but also on the federal side, we'll be expanding into that as well.
Got it. As we look forward, can you speak about some catalysts that investors should be watchful for?
Yeah, so there's a lot of innovation in generally within Syra Health, and when I say innovation, it's not just identifying great products and great solutions, and where we have opportunities with the customers because there's an unmet need. That's what our focus is. But we're also bringing some great innovation by bringing great technologies, right? Utilization of it and put it part of this and in developing them. So that's one part of it. Second one is, of course, growth in behavior mental health. And this is going to be the year for that, they're especially deploying and launching the Serenity and for a different type of audience in the mental health space. And the last one is the growth in the population health. We're looking at the expansion in the epidemiology services, and also we have launched the data hub, and we are using this platform and also we're looking for licensing for the data head platform as well.
Okay, great. And finally, I want to talk about the balance sheet and cash position. Given that you're expecting revenues and margin growth in 2024, is it fair to say you're comfortable with your current cash balance, roughly $4 million post the IPO?
Yes, we are. Comfortable with we are comfortable with our position right now, and also we are looking at great. As I mentioned in the beginning of the conversation, we are a high margin company. We're looking at the high margins coming in, and also great revenues coming for 2024 as well.
Wonderful. Sandeep, thank you very much for your time today. We greatly appreciate it. Again, to anyone who's out there who's not already signed up for a one-on-one, please send me an email at shamsian@lythampartners.com. That's SHAMSIAN@lythampartners.com, or you can visit lythampartners.com/virtual and click the one-on-one meeting request button. With that, we hope you have a great rest of the day. Thank you, everyone.
Thanks, Ben. Appreciate it.